Today we're going to have a conversation about how it is that our health today, especially the health of the littlest and the most disadvantaged among us, really portends the needs of our healthcare system in the future. And what it is that we are doing in order to address these issues, and how what some of the science is telling us about how our health today affects us over the long term. We have a great group of speakers, as I said, as well as an amazing audience full of folks who your participation in this dialogue is really what will be invaluable. I wanted to introduce the President and CEO of the National Coalition on Healthcare, John Rother, and again to thank them for allowing us to be a co-host in this opportunity and for being here today. So, John.
Good morning, and thank you, Dean Osborne, for your gracious hospitality. We'd love to be here for many reasons, one of which is the history. Many of our healthcare programs really date, of course, to the Johnson administration. And today, we're going to talk about what the future holds for many of these programs. The National Coalition on Healthcare is a long-standing, very broad-based coalition based in Washington. We have about 90 different members that are part of the coalition. They represent payers, providers, purchasers, and consumers. And the number one issue across all of those categories is healthcare affordability. And affordability goes to value, but it also goes to the job we're doing for those who are least able to afford health care. Children, minority groups, people with disabilities. So we're going to pay special attention to those issues today. We've been holding events like this across the country with the support of the Betty and Gordon Moore Foundation. So I want to acknowledge their role. And again, thank you, Dean Osborne, for your hospitality today. We look forward to a very substantive morning.
Thank you. And because this is being recorded, I would like to say I did not get a promotion. I am not the dean of the LBJ school. That is Angela Evans, who wanted to be here today to welcome you all, but had other obligations that she wasn't able to. It's my privilege to introduce our first speaker this morning, the Executive Commissioner of our Health and Human Services Commission, Charles Smith. And Charles has worked for the state of Texas for decades in lots of different capacities and has always been a champion for trying to figure out innovative and creative ways to make both our systems work better, but also to really serve the families better. He has been instrumental in revitalizing both the child support system and now at the Health and Human Services Commission to be more innovative in its ways of measuring progress and thinking about accountability to the folks that we serve. And I really have appreciated his leadership and his friendship over these past several years, and I'm so grateful that you were able to come and share with us this morning. So please join me in welcoming Executive Commissioner Smith.
Thank you, Dr. Osborne. I was initially going to say congratulations. I was going to say something happened I wasn't aware of, but that's great. A lot of things happen in the world that I'm not aware of, by the way, but that just comes with the territory. And had an opportunity to speak to Dr. Rother, just a meeting back out in the hallway. And thank you for reaching out to Texas, and thank you for the National Coalition for Health for all the work that you're doing around the country. And thank Dr. Osborne for the work that she has done with the center here at UT We have had a long-standing working relationship over many years when I was at the Child Support Division at the Attorney General's office in working with them, and they were helping us improve our performance because that's one thing that's very important is you have to go back and take a look at the changes that you've made to ensure that they are having the desired result, and the center was very instrumental in helping us make changes that were lasting and important in the child support world. And so we'll continue that partnership as we move forward in working with things at the Texas Health and Human Services Commission. And just thinking about some of the things that we're doing and why this topic is so important and why it's so timely is, and I'm trying to stay here because if I start walking, I'll start talking and I'll go blow your agenda. So I'm staying right here. But we start talking about transformation, and that was something that the legislature is requiring the Health and Human Services Commission to do. They are and have sunsetted agencies, moved them into Health and Human Services, and one of those aspects is so that we can break down silos that are across the system where we have many individuals who interact with the system, but they do so differently and within particular silos. And they're same individuals, and what we're going to try to do is to find a better way for them to access the system, for us to provide more holistic health care. And in the output of that is that we will reduce the overall cost of health care in the state. So one of the programs, I have about 700 programs within the Health and Human Services Commission, and one of those programs, the largest program, is Medicaid. And when you look at the investment that we have in Medicaid in the state of Texas, it is tremendous. Health and Human Services for Texas is roughly a third of our state biennial operating budget. And so when you start thinking about the billions of dollars that flows through the system, it's very important that we are good stewards of the state funds that we've been entrusted with. And my opinion is that stewardship starts with making sure that people get proper and appropriate services at the most opportune time so that we can reduce cost and cost avoidance later. It's not about taking benefits and services away from people in order to save dollars, but to make sure that they have the right access and the right care, which avoids costs later on in life. And so some of the things that we have been focusing on, the state of Texas has had some portions of managed care for about 20 years. And starting in 2022, we began to carve in more and more of our Medicaid population into the managed care arena. And so right now we are running with about 93% of our Medicaid population, about 4.1 million individuals. 93% of that total is in managed care. And the other are in what we call fee-for-service, which means they select their own doctors, go to the doctor, and then there's a payment system that is separate from those that we have that are run by health plans that we've contracted to come in and run the state. And we have 21 of those health plans that are providing services across the state in a variety of different program areas. So one of the things that we've done after moving to managed care is to try and make sure that we're focusing on quality, not just providing and paying for the care, but we want to make sure that we're paying for quality. And one of the things that we have are pay-for-quality measures that we have on our dental programs as well as on our medical programs. And in these programs, we are developing performance measures that started out in September of this past year, 2017. And so we have performance measures that we are expecting these healthcare organizations, whether they're dental or medical, to be able to meet. And we're also stressing the importance of value-based purchasing, which means that we currently are requiring 25% of the managed care contracts to be in value-based purchasing, meaning that they will have sharing and risk measures with the providers to ensure that they're providing quality healthcare services. And we're looking at other alternative payment models and stressing them so that they will continue to provide an incentive for physicians to be able to make sure that we can avoid cost and that costs are not being occurring in the system that are not leading toward successful outcomes, which comes back and really drives our process when you start talking about what does an outcome look like for a person. And what I want our system to do and be focused on is patient-centered care. And where we should be able to have each individual who selects a health plan and a primary care physician should be able to understand what that physician should be able to understand what a successful outcome should be for this individual and to begin to work toward those goals with them. And so we, through some training and so forth in the past, one of the things that, and reading and took a course on Stephen Covey, one of the things that he talked about was starting with the end in mind. And so I continually talk to people at the agency as we are implementing programs or we're looking at new programs or initiatives or even in their current programs that they've been working in for years. One of the things I ask them is, what does success look like? And sometimes you get blank looks and stares. I say it's not a trick question. What does success look like for you? Because if that person can't articulate what success looks like, then where are we leading? Where are we going? And if someone today, and I know this is being shown across the state and maybe the country, and so I'll use an analogy that's regionalized anyway, I'm sorry. If I told someone that we're in Austin, Texas, and they said, well, I want you to go to Dallas, I know that I can go up I-35 north and get to Dallas. But is there a certain time I should be in Dallas? Should I have certain clothes? Should I go to a certain place in Dallas? All of those things that make a difference in my path, my preparation, my arrival, and what I'm able to do. And that's really what we are trying to force ourselves to look at. So as an example, if I have an individual, because some of the biggest cost drivers in our system are high blood pressure, high cholesterol, and diabetes. And we're seeing more and more of those creep into our children. And being the Executive Commissioner for Health and Human Services, I've traveled around the state in every region and in every major city and many of the small cities over the last couple of years, and talking to healthcare professionals. In our minority populations, those are also massive drivers in healthcare. And where you see people that will show up at the emergency room because they're having a headache that won't go away and it's getting worse, only to find out that it's hypertension. And then they also check and, well, maybe they have diabetes. And so you start going through this process. But what I want to do is make sure that we're not just going to prescribe a pill and hand it to this person and say, go take this every day, X number of times a day, and come back and see me next month, and we'll check your blood sugar, we'll check your blood pressure, and then just keep taking the pill. I think we can do better than that. Because for me, that's not the appropriate outcome for that individual. And the other side of that is, if this individual doesn't change their lifestyle, taking the pill just masks the problem. And so what can we do, or how do we interject into the system to incentivize this individual to begin to change their lifestyle, to change the way that they operate on a daily basis? And so those are some of the things that we're really going to be focusing on and working toward. And when you look at children, and it is extremely important because so many of these conditions, while I understand the aspect that hereditary issues can have, and they're huge, but there are also things that a person can do to stave off those hereditary tendencies or predispositions that are there. And what we want to do is stave those off as much as possible. We see children, because they're more sedentary and because of the eating habits, that their obesity is rising. And then we're seeing the onset of diabetes and high blood pressure and all of these other things as a result of that. And that can change the trajectory of that child's life. And just imagine how, if we're able to focus on the family to where that mother or that father or both begin to change their eating habits, change their exercise habits. As a family, let's walk around the block. Let's do some things together outside. Let's put away the games, put away the TV remotes, and let's go outside and throw the ball around, shoot basketball. And let's add in some more vegetables, whole vegetables, fruits, those type of things. That can really change the outcome on this individual. I had a case that came across my desk a couple of months ago, and it was an individual who was morbidly obese, and they had been in the hospital, and they had exceeded their spell of illness. And so there were some concerns about them needing to be in the hospital and going back, and they were needing equipment to help them roll over in bed and all of these, a bed lift and some of these type of things. And the person was in excess of 500 pounds. And so then when you start looking at the other aspects of their health care, and they were on antidepressants along with that, and you just start thinking, and so I sat our team down and I said, let's just rewind this. You have someone who is basically relegated to a bed and a bedroom in their home without a lot of other personal interaction. And we wonder why they're depressed. And this individual had 2 young children. They were 8 and maybe 10 or 11 or so. And so you can just imagine that with the care that's going on and the treatment that is necessary for the parent and the lack of interaction from them to their child, is that, this child will actually at some point begin to act up in school, have health care concerns. The home eating habits could very well be in question. And not that we're going to turn into the home police and go into people's cabinets and take food out and say this is healthy, this is non-nutritional value, that type of thing. Adults make adult decisions. I've always said that. But if we can better inform people, and let's just say we begin to work with this individual about healthier lifestyle and getting them to where they begin to have different eating habits, they begin to lose weight, they then begin to be able to sit up in bed, they're able to get out of bed, begin to walk, they have less reliance on the prescriptions that they're being prescribed. They now have a more active role in their children's lives, which begins to change their trajectory. And so what we have done by getting that person back up in a different role and relationship in the family is those kids will have a totally different outlook. The work that the center does understands the importance of having both parents active in a child's life. And so there are things that we can do from a healthcare perspective that can really make a difference. And not only that, as we are providing those healthy tools and the incentives in the system to be able to do so, then I believe we can also avoid costs for the system. And there are cost savings there because we can begin to drive down the healthcare cost. And because that individual who has high blood pressure that's out of control or diabetes, if we can stave off those things like amputations or dialysis or transplants, all of those things which are paid for in the Texas Medicaid system, we can save hundreds of thousands and millions of dollars over the long run and give these children and give these adults a healthier outlook and trajectory on life. That for them is even better, and it's better for the people that they interact with. And if that individual, we get them up and they're able to work and they return to work, then they're no longer reliant upon Social Security and those type of things. And that individual is working, and there's an increase in their self-esteem and their family self-esteem that goes along with that. And so I think there are many things that we can do to change people's trajectories in life, and that's one of the things that I want to focus on. So what we're doing is we're looking for solutions that are innovative, collaborative, and comprehensive. We have set out in our, that we submitted at the end of December, we published our Health and Human Services Healthcare Quality Plan, actually in November it says, that lays out a path for adapting and reforming healthcare in the 21st century. In this plan, we laid out 6 priorities. Number 1 was keeping Texans' health at every stage of life through preventative care and addressing the root causes of poor health. That's what I was talking about. Number 2, we want to provide the right care in the right place at the right time in the least restrictive and intensive environment possible. The third thing, we want to build systems that limit human error. 4th is promoting effective practices for chronic diseases. Number 5 is supporting patients and families facing serious illness. And our 6th priority is attracting and retaining high-performing providers for team-based collaborative care. I realize that we're going to have challenges as we strive toward success in the future. And one of those big challenges is making sure that we can create the proper incentives to produce change, those outcomes in environments and throughout our healthcare system. But as we work with physicians, our clients, the provider community, our health plans, vendors, and academians to try and figure out and draw the best picture, we want to make sure that we're being collaborative and we're going to bring everybody to the table and we're going to create a clear picture of what success looks like in Texas. And then we're going to make sure that we have the right performance metrics and processes in place to ensure that we can work through and attain that vision. Because if we fail to do so, we fail people. We fail the individuals who are part of our healthcare system. We fail the taxpayers who are providing the funds. And we fail those children who need their parents engaged in their lives and who need quality health care themselves in order to have the best and brightest future. And so for me, failure isn't an option. I've worked, I guess now almost 30 years in state government, trying to make sure that wherever I went, whatever I did, is that we had outcomes that were measurable and attainable, and we would tell people what our goals were, because I want everybody to be able to come in and hold us accountable for attaining those. And so we'll continue to work with you all, and we look forward to the work that you're going to be doing here in collaboration, and we look forward to being a partner with you. Thank you both for the dialogue that you'll be having today. I apologize that I've got to run over to the Capitol, but if things work out, maybe I'll get a chance to run by because I think you all are going to go until about 12:30. And so again, thank you very much. Thank you, Dr. Osborne, for having me.